Hi everyone, Shelley Wall from the Chair of the National Residential Care Alliance. Welcome online today for this very exciting opportunity to have Dr. Lisa Holmes from the UK, University of Sussex, join us for a really exciting presentation on when residential care is the right choice. And just want to start by acknowledging the traditional owners of the land on which we meet and all recognise that we're on many different countries today. I'm joining you from the land of the Yagara and Turrbal people in Brisbane. I know Lisa will acknowledge her own welcome when she starts talking, but yeah, I just want to thank everyone for your interest today and welcome Dr. Lisa Holmes. We're very excited to have you join us here in Australia, and we're looking forward to an exciting talk. If you do have questions come up through the presentation today, please feel free to log them in the chat line, and we'll definitely come back to questions. I think Lisa's allowed a bit of time at the end for a real interactive discussion, so I think you'll look forward to that. But I might hand over to you, Lisa, and we'll get underway.
That's great. Thanks, Shelley, and thank you everyone for joining today. So I'd like to begin by acknowledging the traditional owners of the land I'm meeting with you from today, the Wurundjeri Woi-wurrung peoples of the Kulin. I pay my respects to their elders, past, present, and emerging. I'd also like to pay my respects to any Indigenous people joining us today from around the country. If you just bear with me, I'm going to share my slides for the presentation and for the webinar. So you should now be able to see my slides. Yep, that's a good nod from Shelley. So I'm going to talk to you today on the basis of my learning and my research from the UK. I also wanted to start with something of a disclaimer, because being here in Australia, and it's my first trip to Australia, and it's been a really valuable experience for me to meet with a whole range of different colleagues, to listen and to learn and to think together about our child welfare systems. I also think it's really important to acknowledge that there are huge differences between UK and the Australian child welfare systems, and I certainly do not profess to be any form of expert when it comes to the Australian child welfare system. All of that said, as a bit of a preamble, I also wanted to highlight, for the purposes of this webinar today, I want us to think together on the basis of some of the similarities between the systems and some of the similarities in terms of the children and families that we work with. And the presentation today is on that basis, but I also did want to acknowledge that there are some fundamental differences in our systems and the children and families that we serve. So my provocation to you today is to think together about whether residential care can be a positive placement choice. And I start this by thinking about, as I've already said, if we sort of focus on the similarities and some of the common themes and contexts between the UK and Australia, and particularly how we view and how we use residential care within our child welfare systems. So thinking about some of those commonalities is if we start to think about the needs and circumstances of children and young people who experience residential care and out-of-home care more broadly. So we can see and we recognise the complexity of needs and circumstances of young people. We also have seen in the UK, and again, learning about the Australian sort of context, a presentation yesterday, is the experience of particularly adolescent populations in terms of exploitation within society, and then considerations as to how we need to respond to that within child welfare systems. Also recognising the mental ill health and the mental health needs of children in out-of-home care, and also the intersectionality between mental ill health, neurodiversity, and the needs of our out-of-home care populations. Also, some common overarching themes and contexts is really thinking about, if we're going to consider together whether residential care can be a positive placement choice, we also have to acknowledge where residential care gets used inappropriately and at the wrong time. So again, for us to move towards considering right placements, right child, right time, we have to recognise when we don't do it quite as well. So thinking about the inappropriate use of placements, and again, within the UK context, a sort of contemporary issue that we have been facing is about the use of unregulated placements. So those where young people do not have those same safeguards as where we would have with our regulated placements. It's also recognising that when we are working within a context of residential care being used as a placement of last resort, is that what we start to see is some of the unintended consequences of our national and local and state policies and what that actually means for the experiences of young people. I think we also have to all acknowledge that essentially our public sector funding, federal funding for residential care and for out-of-home care more broadly, is we really need to consider the best use of available resources whilst also recognising that those resources are limited. So again, how do we use our public money in the best possible way? And linked to that, certainly again within the UK, we have seen an increase in recent years in terms of a disproportionate spend on late intervention. So again, lots of rhetoric, lots of reviews talking about the importance of early intervention, but we have still been finding ourselves moving towards that position of having a disproportionate amount of our spend on late intervention. And it's really difficult to shift from that late intervention spending to repurpose that funding into early intervention. I also just wanted to raise this point here around privatisation and profiteering. It's certainly something that's very prevalent in the UK, and in England, over 80% of our residential care placements are now provided by the private sector. Really important distinction here between, we're not talking about all privatisation as necessarily being a bad thing or all resulting in profiteering, but we have seen the increase in some providers within the English context where there is profiteering for shareholders. So that's some of the kind of common themes and context if we're thinking about residential care and how it gets used in our child welfare systems. So before I go on to talk about a specific model that has been developed in England that I'm hoping will have some resonances for you, or for those of you that are joining this webinar today, I just want to take us back to really thinking about residential care and positive residential care, high quality residential care. And I'm hoping that this definition might be familiar to at least some of you on the webinar today. And this definition of therapeutic residential care was born out of an edited book that I worked on with Professor Jim Whitaker and Professor Jorge Devalier, that was published in 2014, where we were really trying to think about, how do we define therapeutic residential care? How do we think about using residential care in a planned and purposeful way, where it isn't a case of a child moving there as a placement of last resort because we do not know what else to do, or because they've already run through a whole series of different foster care placements. So really thinking about planful, purposeful use of therapeutic residential care, where the placement is about meeting the specific needs of children and young people, and about providing the best possible resources associated with that placement. Again, just in terms of setting the scene, before I move on to talking about the specific model in the UK, is really thinking about our underpinning principles of therapeutic residential care. So in addition to that definition that was published in 2014, we did some further work as part of a much larger international working group on therapeutic residential care. And in 2016, published a consensus statement that had 5 underpinning principles. which essentially I'm paraphrasing here, but I just want to briefly introduce these to you because I think it's really important to understand these principles and to consider these when we're talking about residential care. So in terms of those underpinning principles, really important to think about essentially, primarily, when we are using residential care, and if we are going to consider that it can possibly be a positive placement choice, then essentially it has to be predicated on the position of doing no harm. We also advocate for and emphasize the importance of family partnership. This is not about thinking about residential provision that is entirely separate from the families. It's very much about partnership working, thinking together, working together. And very closely linked to that is really recognizing that good quality therapeutic residential care has to be embedded in community, culture, and social relationships. So it's contextually grounded. If we are moving young people to placements hundreds of miles away from their family, from their culture, from their society, their community, then we are not really focusing on good quality therapeutic residential care. We also suggest and advocate that therapeutic residential care has to be predicated on learning through living and the importance of relationships. That's recognizing the importance of relationships already between young people and their birth families, but also relationships with their peers living in residential care and also relationships with the workforce. In order for therapeutic residential care to be good quality, there also needs to be a commitment to evidence and learning. It's about recognizing the importance of generating evidence, of being able to provide good quality data, to be able to assess and to consider whether residential care is achieving what it set out to achieve and the outcomes that it is achieving for young people. Okay, so that's my preamble, and I want to now introduce you to some work that started in England around about 10 years ago. I wasn't involved in the development of the model that I'm going to talk about today, referred to as No Wrong Door, or NWD, as colleagues quite often refer to it. It was developed by one of our child welfare agencies, public sector teams in England, and I was appointed some 10 years ago to do the evaluation of No Wrong Door. So in the webinar today, I'm going to introduce you to No Wrong Door. I'm then also going to present to you some of the highlights from the initial evaluation. And then I'm going to talk to you about the shared commitment to evidence and learning, which, as I can already see on screen, was our fifth principle that was guiding our consensus statement. So if we take ourselves back 10 years and the team that developed No Wrong Door, it was their sort of position here in terms of thinking about why they needed to do things differently. Why did they need an alternative? And as a child welfare agency, what they were identifying in terms of changes over time is that for many of the high needs youth, young people in out of home care, or potentially needing out of home care, is that many of them didn't fit with the traditional approaches. And again, through doing the work evaluating No Wrong Door over the years, we've talked a lot about the rigidity of systems and how our certain approaches in child welfare systems quite often don't meet the needs of young people. What the team also identified is that quite often, inadvertently, there was causing more harm than good. What was happening is that children were coming into the care system at a later age, or that they were failing up into residential care. They also identified that many young people were either coming to the attention of child welfare agencies, or they might possibly have been identified as having other needs or other involvement with other agencies. So essentially, particularly the adolescent populations may well have been presenting to child welfare services or to youth justice services or to mental health services. And essentially, what was in existence in terms of the status quo was the whole range of disconnected silo working. So the team in North Yorkshire in England who developed No Wrong Door had sort of used this as a moment to pause, to reflect, and to think about actually, could they do things very differently? That was their focus on their kind of own geographical area. And then at the same time, in the UK and in England in particular, we were seeing national austerity. So we had experienced the economic global downturn, and there were huge cuts to our child welfare systems. So whilst we had complex needs of children and young people, the needs to think about specialist placements, we were also in a position of national austerity. We also identified, and again, there have been several national reviews of our child welfare system over the last 10 years in England and in the UK, in terms of identification that actually where we were having youth moving into residential care, quite often they were being moved some distance away from their home and their community. And if you think back to what I've already presented today about our principles around good quality therapeutic residential care, moving young people away from their home, their family, their community, that does not meet the needs of young people. It's disconnecting them from their lives as they exist. So the challenge that the team faced were really thinking about what evidence already existed, what could they use to inform the foundations for them to rethink how they used residential care. And in their own words, what they felt that was needed was the strategic vision, drive, and challenge to essentially think about the traditional systems and to change those. And through all of this background thinking, planning, working, and again, really sort of highlighting as I talk about No Wrong Door today, I'm going to talk about the model as it was developed, as it has been implemented. And I think it's also really important to highlight that actually there were years of preparatory work that happened here within the local child welfare agency, but also with their partner agencies, so the police, youth justice, health, mental health services, housing, to all work together to have that shared vision to move away from the very traditional child welfare system of the use of residential care much later in a care journey. So I'm now going to introduce you to No Wrong Door. So I think one of the simplest ways of thinking about No Wrong Door is essentially in terms of where it fits within child welfare systems is quite often referred to No Wrong Door as a residential care service, which is much more thinking about using residential care as early intervention rather than late intervention. And I'm going to talk about that a little bit more as I introduce you to No Wrong Door. So essentially what it is, it's an integrated service for young people with complex needs. Underpinning No Wrong Door is a shared practice framework that is predicated on signs of safety. And within that shared practice framework there's a team of specialists who work together. And again, this is very much about a multidisciplinary team, which again, I'm going to talk a little bit more about. At the absolute core of No Wrong Door is about key worker relationship. So it's very important in terms of the young person who is referred into the No Wrong Door service, having that key worker, and that key worker stays with them regardless of whereabouts in the system they are being supported. The other core component in terms of No Wrong Door and what it is that it is a residential service run through 2 residential hubs, but it also includes in-home support in the community. And this goes back to my point about residential care as early intervention. For many of the young people, they receive support through No Wrong Door as an alternative to them going into out-of-home care. So it's very much about a respite or a support service rather than a longer term placement in residential care. So in terms of the young people who are referred to No Wrong Door, it's a service that's in place for all young people between the ages of 12 and 25. And young people might be referred because they're already in a placement. So they might already be in a placement with kinship carers or with foster carers, and there's some risk of instability. So it might well be there's some difficulties within the placement. Or for those young people who are still living with their birth family, but there is an imminent risk of them needing a placement. Or for those where actually there's some early signs that a family might be struggling. Again, this is where we would quite often find those families where some young people within the household are at risk of exploitation, or an older sibling has been exploited, and then it's thinking about the younger siblings. So it's that sort of moving towards some of those risks. Again, if we think about these different populations of 12 to 25-year-olds and how they get identified and how they get referred into the No Wrong Door service, this is where it's sort of highlighting again the early intervention rather than the late intervention. So in terms of what No Wrong Door looks like as a service, as I've already said, there's the residential hubs, and then they also offer in-home support. If you can just sit there at this webinar and visualize what a usual linear kind of pathway through out-of-home care might look like for children and young people that you have supported or that you're aware of, where you might see them sort of running through a range of different placements. So moving from kinship placements to foster placements to residential placements. That might be a very kind of hierarchical approach to residential care. But usually what we see, certainly again within the UK, is a much more linear pathway through a series of placements. So what No Wrong Door does is to change it to a much more flexible care pathway with those residential hubs at the centre. And so what you can see here is essentially the opposite of a linear pathway. At the centre, we have these two No Wrong Door hubs that are residential homes. Essentially, they are four-bedded residential hubs that sit at the centre of No Wrong Door. But you can see from all of the lines on this figure is essentially a young person who is referred to the No Wrong Door service may go and stay in the No Wrong Door hub, or they may remain at home with their birth family and receive some form of support or respite from the hub, or they may continue to stay with their birth family and receive outreach support from the staff within the No Wrong Door hub. So absolutely pivotal within the No Wrong Door hub is recognizing and having a staff group that includes what we would tend to consider a more traditional residential care staff group in terms of key workers. But those key workers also spend a lot of their time doing outreach work. And the important part here of them doing outreach work as well as being based and working within the residential hub is they offer that continuity. So it doesn't matter where the young person is in terms of that hub model. They might be with their birth family. They might be staying in the residential hub for a number of weeks or even months, or they might be staying in the residential hub as a respite placement. Or as you can see here, there are also community families or foster carers attached to the hub. And it really doesn't matter where or which part of the No Wrong Door hub that or the model that the young person is in, their key worker remains with them. So the continuity is around the worker. The flexibility is recognizing that needs and circumstances of young people throughout those adolescent years will change. And so essentially it's about having a model and a way of them sort of living and moving between different parts of that model that is designed to meet the needs at that specific point in time. So you can also see within this hub model that a key component of it is the high needs supported lodgings, or supported accommodation. So these are forms of semi-independent living, again, predicated on the same practice model, still supported by the same key workers, but where young people might be living semi-independently. It's also recognizing, and again, I'm hoping this will resonate with many or maybe all of you on the call today, is that we know for many of the young people who have experienced out-of-home care, who are aging out of the system, they're often having to experience semi-independent or independent living at a much younger age than many of the young people in our society. Again, with the No Wrong Door model, this is about recognizing that for some young people, they might think that they're ready or they want to trial the sort of semi-independent or supported accommodation. Is again, for those young people, if it is really not right for them at that point in time, they can move back to the residential component of the hub. Another core component of the hub model, in addition to having the residential care staff who operate and have this function where they work residentially as more sort of traditional residential care staff and as outreach workers, is there's a whole range of specialist roles within the No Wrong Door hub. So intrinsic in the No Wrong Door team are clinical psychologists, and speech and language therapists. And this is again sort of recognizing the needs and circumstances of the young people who are referred to the service. It's about realizing that for young people to access clinical psychology support, mental health support, is quite often they're experiencing really long wait lists, or they might get referred to a service and then find it really hard to engage in a service, which again is predicated on very rigid systems, where the expectation is that the young person will go to a mental health service, usually a kind of office building, to meet a new professional at a designated time as determined by the service. By having the clinical psychologists and the speech and language therapists embedded within those hubs as part of that core team, it means that that interaction with those specialist services happens on a much more informal basis. Another core component of No Wrong Door in terms of the staffing is the inclusion of police roles within the hub. Again, when I first started the work to evaluate No Wrong Door, I was really sort of intrigued as to the thinking and the understanding and the rationale for the inclusion of police roles. But again, this was very much predicated on trying to change the relationship between the police and the young people, to ensure that there could be opportunities for positive interactions, and for both the young people to realise that actually, in some circumstances, the police can be there to help and support, and equally for the police to shift their ethos in terms of not necessarily thinking about young people with complex needs as being offenders, but also recognising their vulnerabilities and quite often being victims of crime as well as perpetrators. So the No Wrong Door Hub has got this interdisciplinary team. And as I say, huge component is about the edge of care support and about young people being able to move flexibly through different parts of No Wrong Door to meet their current needs and circumstances. Okay, so that's the introduction to the hub model. One of the other things I just wanted to highlight in terms of No Wrong Door, and again, sort of really going back to those early days of when the team were developing No Wrong Door, and they still stand by these, essentially what they refer to as provocations. And so actually, if the team who had developed No Wrong Door were here with us today as well, they would talk very strongly about their provocations, because these provocations were what were driving the development of No Wrong Door and are still absolutely intrinsic in terms of the ways in which they are thinking and operating today. So again, really thinking about, would this be good enough for my child? Thinking about, what is it that we are trying to achieve? What is it that we're trying to do in terms of the support and the services that we are providing to young people in our care? Would this be good enough for my child? And also thinking about what kind of adult do we want them to be. It's not just thinking about them in their teenage years, but thinking about what kind of an adult do we want them to be? What kind of an adult do they want to be? What do they want to aspire to when we think about the longer term? Again, it's thinking about longevity, it's thinking about longer term outcomes. A core component of the development of No Wrong Door, and actually around the evaluation as well, was really thinking about organizational risk versus individual risk. And we had lots of conversations here in terms of thinking about how quite often child welfare systems and organizations are thinking about managing risks for the organization rather than for the child or the young person. And for those of us that have been parents of teenagers and recognize and understand the development phases of adolescence, is really thinking about, can the young people who are living within No Wrong Door and within our child welfare systems more broadly, can they be supported to take some safe risks? Or actually, are we predominantly thinking about risks for the organisation? What are the risks that this organisation would face? What are the implications of things going wrong? The other is also really thinking and emphasising a shared approach to parenting. Again, this is about thinking for the majority of the young people receiving support through No Wrong Door will remain living with their birth families. So again, it's thinking about a shared approach to parenting. Going back to some of those specialist roles that exist and work within the No Wrong Door Hub, yes, they are there to support the young person, but they are also there to support the birth family and to support the workforce. And so sometimes if there's certain behaviours that those adults around the young people are struggling with, then the clinical psychologist would work with the young person, but they may also work with the birth family or with the workforce in terms of thinking about what are the most appropriate ways of addressing and supporting the young person with those behaviours. Okay, so those are the provocations, and I am going to move on to the evaluation in a moment, but I just wanted to, because essentially you're hearing about No Wrong Door by proxy, by hearing about me as the person who evaluated it, not the person who developed it. I just wanted to include a quote here for you, just to highlight from the words of one of the hub managers. Is that it's not always easy. And I don't think that any of us that have worked in residential care or continue to work in residential care would ever consider it to be an easy job or profession or career. Okay, so this from one of the hub managers. We must be creative and aspirational in our approach to supporting young people in and on the edge of care. Edge of care is the term that we use a lot in the UK for those young people who remain living with families. In short, every day you need to have a shower in resilience. Put on your shoes of ambition, your hat of flexible thinking, and pick up your bag of compassion. Okay, so I'm going to move on now to talk to you a little bit about the evaluation of No Wrong Door. So our evaluation of No Wrong Door started in 2015 and ran for 2.5 years. And again, as I mentioned at the outset, I'm going to talk a little bit about the shared ongoing commitment to evidence and data generation that transcends that formal evaluation. So the initial funding for No Wrong Door came from our national government department as part of a much wider initiative in children's social care. So we had the introduction of the Children's Social Care Innovation Programme, where providers, child welfare agencies could apply for funding to try out new innovations. And I was appointed as the evaluator for No Wrong Door. So our starting point for the evaluation and for the team that were working with me on the evaluation was to do ethnographic ethnographic visits to the hubs. I say this as an academic who actually started my career working in residential care. That wasn't the position for all of the researchers on the team. So we wanted to ensure that before we started the evaluation, all members of the research team had spent some time in the hubs so that they had an opportunity to familiarise themselves with the operations of the No Wrong Door hubs, of being in the residential settings, but also for the workforce and for the young people who were supported by the service at the outset to become familiar with the research team as well. Right from the outset of our evaluation of No Wrong Door, we developed a child level data tracker, which was a way in which we captured the characteristics and needs of young people referred to the service, so at the point of referral. And we also captured information on outcomes on a monthly basis. And I'm going to come back and talk about this in the last part of the webinar. So I'm just going to leave that there for the moment. In terms of standardised tools to capture mental health and well-being, we use data around the Strengths and Difficulties questionnaire and also the Warwick Edinburgh mental well-being scale. So in terms of an evaluation design, one of the difficulties we had with No Wrong Door when it was first developed is that there wasn't a comparison group. No Wrong Door was offered to all young people in the area who met the eligibility criteria. So between the ages of 12 and 25. And if you can sort of recall back to one of my earlier slides about those young people that were either already in care and experiencing some instability in their placements, or were living with their birth family and reaching that need where essentially they were going to require placement. So what we did with the evaluation was to look at comparative data in terms of doing pre-post for the original evaluation of No Wrong Door, so to look at what was happening to young people prior to the service. And we also used some comparative data from the national data of other child welfare agencies, and particularly, so again, within England, we have what our government refer to as statistical neighbours, where there are other regions, other local authorities that are considered to be statistically similar. So we did comparative analysis with those as well. So in terms of our qualitative interviews with young people, I mean, I think you would see from this slide and the subsequent slide is that our evaluation approach was pretty standard in terms of mixed methods, qualitative interviews with the young people, both at baseline and then at follow-up. We also did qualitative interviews with those key workers. So again, looking at those key workers who are working with the young people, both within the hub and also out in the community. Also doing semi-structured interviews with the staff. So again, all of the different types of staff roles that I've referred to today. We also included in our qualitative evaluation some semi-structured interviews with the foster carers. So both the foster carers who were part of the No Wrong Door model, but also other foster carers who were being supported by the No Wrong Door model. Again, given the emphasis on using No Wrong Door as this sort of more early intervention service and to support young people to stay at home with their birth families, we also included interviews with birth family members. We also included a very small number of adopters. That was not something that we had expected to see at the outset of the evaluation, but as No Wrong Door was implemented, it was also used to support some adoptive households where adoptions were at risk of breakdown as well. So it was another group where the service ended up sort of being used for those families. Okay, Our evaluation also included an economic component, and so obviously we needed to include the collection of finance data. So that was capturing data about the funding that had come from the government to set up No Wrong Door, and then also for us to look at that finance data in more detail in terms of staff salaries, expenditure for No Wrong Door, looking at the cost inputs, but also looking at some of the placement costs that were then costs avoided through the course of providing No Wrong Door. Okay, so I'm just going to run you through some headline findings from the evaluation. On each of the following slides, there's 4 of them. I've also included some of the quotes from the young people. So I just wanted to include some of those quotes as well as some of our headline statistics. So actually, in terms of thinking about No Wrong Door as early intervention service, 86% people who were referred to No Wrong Door over the course of our evaluation period remained out of care. So that meant that they were supported by No Wrong Door. They remained with their birth families. They may have spent some time, like on a respite basis, in either the residential hub or in other parts of the service, but ultimately 86% of them remained out of care. For those young people who were in care, we saw a reduction in placement moves. And we also saw a reduction in the length of care episodes. And again, going back to the rationale behind No Wrong Door and the team that developed it, it was very much about actually if we can make sure that there is a key worker who is adequately supporting birth families, then they can try to reduce the length of care episodes where children do need to come into care. Obviously, that only works if we don't then end up with further issues downstream, essentially, where you can reduce the length of care episodes or you can ensure that young people remain out of care. But without adequate support to them and to their families, quite often what we have seen in other research is that we have re-entries to care. But again, with No Wrong Door, with the evaluation, we saw very low numbers of re-entries to care. Again, going back to my earlier point about the rationale for the introduction of No Wrong Door, is there was the situation where a number of young people were being placed, what we would tend to refer to in England as out of authority placement. So that is where a young person is being placed away from their community, away from their family. And so again, within North Yorkshire, No Wrong Door model is they saw over the course of the evaluation period was a reduction in the use of these out of authority placements. So we've got a quote here from a young person, just for information with the use of acronyms. PRU is a pupil referral unit, which essentially is an education provision that is provided for young people who have been excluded from mainstream school. Okay, so going on to some of the other headlines from the evaluation. So we were also looking as one of the secondary outcomes for No Wrong Door was offending behaviours, so involvement in criminal justice and criminal offences, and also young people going missing. Again, what we know from wider research is young people who go missing from their placements, who go missing from their home, are the ones who are at more risk of being exploited through gangs, criminal exploitation, sexual exploitation. For the young people who referred to No Wrong Door over the course of our evaluation, we saw a reduction in arrests. So again, going back to my earlier point about this was a pre-post comparison. So in the time prior to referral to No Wrong Door, and then time where the young person was supported through No Wrong Door, we saw a reduction in arrests. We also saw missing incidences being halved, so over 500 missing incidences in the time period leading up to No Wrong Door, and this reducing down to the time when young people were supported. Again, more quotes here from the young people, just highlighting how they were feeling at the point at which they were referred to No Wrong Door and as they were being supported. Okay, so moving on to some of the other headline findings. Okay, and I just wanted to highlight here with the offending and the missing incidences. Again, I'm sure you'll remember having that police liaison role within the hub. What we also saw is, because again, looking at the ways in which the young people were interacting with the police, because again, if we think back to when we change services and support for young people in child welfare systems, what we're hoping to achieve, and again, having this police liaison role within the hub, it was quite a unique way of working. But again, through our statistical analysis, we were able to look at the positive influence of the police liaison role. And we could see correlations between direct support between the police liaison role within those hubs and the missing incidents. So we were, in our monthly data tracker, we were capturing the frequency of interactions between the police liaison role and young people. Okay. So I also mentioned, in terms of emotional health and well-being, that we were looking at strengths and difficulties questionnaires, and we could see across the board reductions in strengths and difficulties scores. So again, for those of you that are familiar with Goodman's strengths and difficulties questionnaires, a score over 17 is considered to be higher mental health and well-being needs, and we could see the numbers of the young people supported by No Wrong Door, their SDQ scores reducing. We were also capturing information at point of referral about self-harming and suicidal ideation and suicidal attempts. And we were capturing data about whether there were continued to be any presentations at accident and emergency, so at our hospitals, for self-harm incidences. And again, we saw reductions in those over the course of our evaluation. And again, as we found with the police liaison role, we also found these correlations between the direct support from the specialist hub workers. So again, in terms of the terminology within No Wrong Door, they refer to the clinical psychologists as life coaches and the speech and language therapists as communication support workers. Again, where we could see that there was that direct but very informal ways of working and interactions between the young person and those workers, there was the reductions in the SDQ scores. Again, really sort of trying to highlight those roles where ordinarily for young people, when they're in care or when they're supported by child welfare systems while still living with their birth family, in order to meet those, to get access to those specialist services, often they have to go through much more formal routes. But as highlighted in this quote here from a young person, is about they help you through stuff, and you can come in and ask to talk about anything. They'll let you come in and have a chat. So again, it's that emphasis on the very informal interaction between specialist roles and the young people. Okay, and the last one of some of the headlines of the evaluation findings. So we were also capturing data around education, employment and training. And we could see, again, is that around about 3/4 of the young people maintained their involvement with education or employment and training during the course of the evaluation. We could also see some increased engagement. And again, this was where we had young people who may have been attending school, but attending school on a very part-time basis. So when I'm referring to increased engagement here, again, this was they were still engaging with school, but they were actually starting to attend on a more regular basis, or maybe that they were able to attend more sessions in a week than they had been able to previously. The other thing, again, particularly around the inclusion of those speech and language therapists and the ways in which they were interacting with young people, is they were helping them with those strategies to support job seeking. with that emphasis on advocacy. So again, what was evident through the evaluation was that many of the young people, as they were reaching that point of joining the workforce, they found the whole process of job seeking quite overwhelming. They might be receiving letters and they were struggling to understand. So again, real emphasis here on advocacy to support the young people so that they could make sense of how to move towards becoming an adult and about moving into the workplace. Again, just a very quick note here about acronyms. I'm hoping maybe it's familiar to some of you, but again, in terms of our statutory schooling in England is our 16-year-olds all sit their GCSEs, which are essentially their general certificates of education, and quite often within research and within society more broadly, we're always looking at did young people, when they hit the age of 16, did they manage to get some GCSE grades? And that's usually a measure of educational outcomes. Okay, so I appreciate this is a really kind of quick sort of tour through both the introduction to No Wrong Door and the evaluation, but we will have some time today for questions and discussion. So obviously very happy to come back on any of these points. But for the last few minutes, I just wanted to focus on the point that I raised earlier, and again, sort of thinking together about meaningful data and evidence. And again, thinking about when we develop different models or innovations or programs, or however we want to talk about them within child welfare systems, is how do we make sure that we do good quality evaluations, but also how do we do that in a way that we're thinking about services and supporting services to generate meaningful data and what evidence they need to support sustainability of programs. And one thing I'm really not sure about at all in Australia is the degree to which is so prevalent in England and the UK, is the time frame for generating evidence and the decisions that get made about new programs and how they have to evidence change, sometimes quite quickly, to say, yes, this is worth investing in, or yes, this is worth us continuing to invest. And we quite often face difficulties around how is it that child welfare agencies around public sector can be in a position to convey and to argue to those that make the sort of financial decisions that, yes, this is the right thing to be doing, and yes, it's a good use of money. So this was really sort of one of, I think for me as an academic, was really one of the exciting aspects of working on the evaluation No Wrong Door, that was essentially a kind of subsidiary to seeing how the No Wrong Door model got developed, and working on the evaluation was really thinking about what do we mean by meaningful data and evidence, and what do we need for our child welfare systems? So just going to introduce you to the kind of guiding principles that were predicated in terms of the ways in which we work together in terms of the team developing and implementing No Wrong Door and ourselves as the evaluators. So absolutely fundamental from the outset was a shared commitment to evidence generation. It was very much about having this singular vision that we needed to make sure we had really good quality data and evidence to inform discussions and debates about No Wrong Door. And ultimately, if we think back to my description of No Wrong Door, and hopefully it was sufficiently clear, where you could see that flexibility in the system, young people moving to different aspects, but also that multidisciplinary team is actually, this is an expensive service. There's lots of specialist roles. In order to offer flexibility, in order to have that flexibility in terms of the numbers of children who are spending time in the residential hubs, to have some empty beds as such, it all comes with a cost. So if we are spending public money in that way, then we need to really think about how do we evidence that this is the right thing to be doing. So, as I say, from the outset, this shared commitment to evidence generation. I remember back to the sort of very early conversations with the team developing No Wrong Door and actually going off to my interview for them to decide who they wanted to be their evaluator, and talking very much at those early stages about wanting to avoid feeding the beast. When we tend to think about evaluation as this separate beast where there is about data and evidence and everything going off to this external evaluation beast and nothing coming back to the service. So it was something that they really wanted to avoid. And related to that, we talked a lot at the outset about thinking about relational evaluation. So it wasn't about transactional evaluation. It's something that I talk about a lot in my other wider work, particularly thinking about meaningful evaluation and how we do evaluation well is moving towards a position of doing relational evaluation rather than transactional is not straightforward. And it's also trying to get that balance between ensuring that the evaluation is predicated on academic rigor and robustness, but again, is not about transactional evaluation. Okay, and linked to that, it was this really sort of trying to think about an evaluation design and a commitment to generating data and evidence right from the outset to inform sustainability. So how does something like No Wrong Door continue to exist when it is an expensive service? What is needed? Linked to that was really sort of emphasizing what's meaningful to collect rather than is easy to collect. And quite often in England and the UK is we see evaluations where the outcomes are being measured on data that is included in our administrative data sets. Because our administrative data sets are mandatory data returns for all child welfare agencies, we tend to have an over-reliance on those in evaluations. And again, they're not always the most appropriate outcome measures for the service, and they're not always the best outcomes that we're trying to achieve. So again, really trying to think right from the outset about what's meaningful to collect rather than easy to collect. Okay, so that's all our kind of underpinning guiding principles that we really kind of agreed to at that point of me being interviewed for the evaluation. So what did we do in terms of our approach? So as I mentioned right at the outset when I was introducing the evaluation, we developed, co-produced a child level data tracker. So that was again working together to think about what information is already routinely recorded on a referral form. What does that look like? Can that be produced into a data tracker? And then how do we continue to collect information on a range of meaningful outcome measures? So at the outset, we co-produced a child level data tracker. The first version had to be revised quite a lot because again, it was about working with the core team, developing No Wrong Door. It was then also opening up to discussions and workshops with young people and also the workforce. So very much about this kind of co-production approach to the child level data tracker. I think the team in North Yorkshire who developed No Wrong Door also had real foresight to include in their original funding application an embedded data analyst. And that data analyst is still in post. And I think if my 25 years of my academic career now is that actually one of my proudest moments, and I feel like I've actually achieved something here, is our evaluation of No Wrong Door finished in 2017. There is actually a separate randomized control trial that is ongoing at the moment that's being conducted by our government, which is about how No Wrong Door has been adopted in other geographical regions. But in terms of North Yorkshire and the work that they are doing, where they have now embedded No Wrong Door in their core essentially practice model for child welfare, is the co-produced child level data tracker. We finished the evaluation in 2017, but North Yorkshire still use a version of that data tracker now. And the embedded data analyst continues to produce analysis from that data tracker. So for me, just thinking about sustainability of evaluation and the ways in which child welfare agencies are using data in a meaningful way, it's really good to see that it's had that longevity. So as I've already said, very much about the work with the data tracker was in consultation with young people and with workers. The mental health measures that we used, again, that was very much about consultation and working with young people about what they felt were the tools that they would be most comfortable completing. Going through this process of reviewing and refining, and as I've already said, the first version of the data tracker then did get amended over time. It was also really thinking about data for multiple purposes. So I've sort of used that kind of colloquial term of feeding the beast. But again, it was thinking about not just generating data that was going to be used for an external evaluation, but what data, what analysis was going to be meaningful to support operational practice of No Wrong Door, and also thinking more strategically and for the other kind of decisions and discussions that senior leaders in North Yorkshire were having. And linked to that was the importance of feedback loops. Again, I'm sure that many or all of you on the call will know that the more that we ask frontline practitioners to collect data, to record things, is if they are doing that, but they don't ever get any of that analysis back in a meaningful way, that is not a good way for them to be recording information. But actually, if we do it and we generate and we predicate on feedback loops and making sure that that analysis can go back to inform practice, that they can see what is doing well, but also what might need to change. So really emphasizing the importance of those feedback loops. Okay. And here we've kind of we've used this on several occasions over the years as we've presented together on certain occasions, really thinking about, okay, so that No Wrong Door data it has those multiple purposes and it can be used in lots of different ways. And by having the embedded data analyst as part of the ongoing costs of running the service, is they're able to generate the different forms of analysis to be used for multiple purposes. Again, apologies here for acronyms. So the DFE evaluation, so that was our external evaluation that was funded by our government. So that's the Department for Education. So in England, our child welfare services are actually under the Ministry of Education. But again, that data being used for the feedback to the hubs, as I've talked about. It was also thinking about how it could inform other local authorities that were thinking about implementing No Wrong Door, raising the profile. They also used it to mainstream No Wrong Door. So again, as I say, it's now embedded in the core practice in North Yorkshire. And linked to that, being able to produce thematic reports and calls for evidence that could then be used for national influence and, in some instances, some international influence and international conversations. And then importantly here is around the governance. So again, having the data, having the ways in which the data is reported and recorded in a way that is helpful for members, so those who have responsibility for the finances and also the governance around the project board. So again, really thinking about ways in which data can have multiple uses and how the value of data is driven by how meaningful it is, particularly for evaluation and for operational and strategic practice. And that brings me on to my last slide with some time, which I'm going to hand back over to Shelley for us to have some questions and discussions. So Shelley, I'm going to stop sharing and have a little drink of water.
Sounds good. Thank you, Lisa. And, I think thanks to everyone online, I'm sure that we can all agree it's such important, interesting information. And certainly I've had the privilege of meeting with the No Wrong Door people at various international forums now over the last few years. And, I think it's such an impressive model that I wish we could get more of that emulated here in Australia. So please throw your chats in, any questions that you have into the chat group. We've got one to start us off, and I think Tracy Ryan. Thank you, Tracy. Thanks. And Tracy says, thanks for the presentation. Can you give a bit more information on the scale of the model, please? How many young people are able to be supported at any time? Has there been an analysis of cost avoidance as part of the evaluation and evidence to support the cost of the model?
Yeah, sure. Thanks, Shelley, and thanks, Tracy. So, in terms of the scale of the model, as I've already said, most of the young people were supported within their families. So in terms of the size and scale, there are the two residential hubs which only offer sort of 4 beds each, and then a small number of foster carers with a few beds. At any one time, there's usually around about 100 young people being supported by No Wrong Door, but with most of them remaining with their birth family. So the scale of it is, I think that's a pretty good scale in terms of the numbers being supported at any one time. In terms of the cost avoidance, yes, there has been an analysis of cost avoidance. It was included in the original evaluation. So what we did is we looked at the monetizable outcomes within the original evaluation. So those monetizable outcomes related to the avoidance of the out of authority placement. So as soon as young people have to be placed outside of the area and usually in high cost external placements. So we looked at that as one of the costs being avoided. Also for the numbers of young people, so you'll remember it was 78% of the young people remained living with their birth family. So again, was looking at doing some modelling of some of those young people had they come into care. But we also looked at the monetizable outcomes associated with children going missing from placement. So again, we know that there are costs associated with child welfare agencies when young people go missing, but also costs to the police and the processes that we have in England when a young person goes missing and the amount of police time that takes. And we also looked at the costs avoided around the reductions in criminal behaviours. So I know there's quite a few questions coming in. So, but the other thing just also to say was in terms of that initial work on cost avoidance. I've talked a lot about the costs that were avoided, but we also saw the increase in costs not only associated with the model, but actually more of the young people were accessing some of the mental health support services. So again, what we saw is that by having the clinical psychologist in the hubs, they were it meant that young people had the informal interactions, but it also meant that if young people needed additional specialist mental health services, they were receiving and had access to more services. So there were additional costs there. Just also to say there is still some more ongoing work that North Yorkshire as a local authority are doing around cost avoidance, and they have developed a tool that I've supported them with where they use it for themselves, but then that tool is made available to other areas in England that are also now implementing No Wrong Door.
Thanks, Lisa. And I think, one of the things that's always stood out to me about No Wrong Door is the willingness to assist with support services that help keep people out of the system. So I think that's another really important aspect of the model, is not being frightened to spend money, say if housing's the biggest issue, being able to support with rental payments and other sorts of supports like that help avoid much larger costs. So spend some money to avoid other larger costs. I think that's been an important part of the model. Philippa Byers, thank you to you for your question. Lisa, could you say some more about the key worker role, please?
Yeah, sure. I mean, and the key worker role was kind of quite a standard residential care social worker role. So we would tend to have a residential social worker who is based in the hub and is predominantly working within residential homes. The key worker role, the shift work there was about them doing the outreach work. Again, I was talking about this yesterday. It was quite a shift for workers who were used to working in residential homes where their work was predominantly with the young person. Within No Wrong Door, there was quite a lot that was needed around skills development for them to work with the birth family. So where historically they had worked very much with the young person in the hubs, the proportion of their time was around about 40% was then spent on outreach. So they were spending the time on outreach. So it was that shift to working with the birth family. So it was much more akin to, again, in England, what we would tend to have as family support workers. So for children who are supported in-home care, we would have a family support worker, which is separate to a key worker in a residential care home. Whereas with the key workers, as part of No Wrong Door, they were having to kind of transcend and work both parts of the system. And I think, again, thinking back to our process evaluation, that was quite a difficult shift for them to move from that very kind of traditional residential care worker to picking up some more of that kind of outreach and family support work.
Thanks, Lisa. So Vicky Watkins asked, you mentioned a 12 to 25-year age group. Were there any challenges regarding having such a wide variation in the ages?
Yes, that's the short answer. But yeah, so particularly around the residential hubs post 18. And I think, again, from some of the conversations I've had here in Australia, this is part of the issue again for young people aging out of the residential care system is our structures and systems don't allow young people over the age of 18 to live within residential care. So again, the ways in which they had to operate and find ways of supporting over 18s was very different in terms of, so it raised a whole range of those sorts of challenges. It also raised challenges with our inspectorate. So in England, all of our children's homes are inspected. And so there were a lot of conversations with our inspectorate about how that could work. I think just one other thing to say, so it had the kind of operational challenges, but there was that recognition that actually there needs to continue to be that support for young people up to the age of 25. And North Yorkshire as a local authority have since made an announcement and a commitment to support any adult who was ever in care in North Yorkshire. So if you are an adult and you experienced a period of time of being in out-of-home care in North Yorkshire at any point in your life, you will be supported for the rest of your life. So there is no cut off there, which again is quite an unusual way of working to see that kind of lifetime commitment.
It's very exciting. Elisa Willis has asked, fantastic model. Has it been replicated and scaled anywhere else?
So yes, so it's the No Wrong Door team would tend to refer to adopt and adapt. So there are a number of other local authority areas in England that have adopted and adapted No Wrong Door. So in England, we have 152 local authority areas. North Yorkshire is one of them, but it's a particularly large, it's one of the largest five. And there are a number of different other local authorities that have adopted and adapted No Wrong Door, and they are part of the ongoing randomised controlled trial that's currently being carried out by our government.
Thanks. Amanda Shaw has asked, what have been the thoughts regarding No Wrong Door as an early intervention approach for those under 12 years of age, given the hubs and in-home support approach?
Yeah, it's a really good question and actually sort of links to the previous one in terms of the replication and the scaling is where No Wrong Door is being implemented in other areas. Some other areas have decided to reduce that age group. So down to, I think the youngest is taking 9 or 10-year-olds. So again, it's sort of recognizing that for some of those young people, and again, we've seen other projects in England at the moment, it's that sort of middle childhood from about the age of 8, where there sort of needs to be that work. So again, it's being tested with some of the other areas that are implementing No Wrong Door, but it remains with the 12-year-olds in North Yorkshire.
Great. And so Deb Howcroft has asked, thanks for the great presentation. Would it be possible to hear a little bit more about what the police liaison role entails?
Yeah, so the police liaison role is very much about sort of being and sort of working within the residential home. So a bit like a residential social worker would be. So it's about sort of being in the home, part of that staff group. Um, Interacting on a one-to-one basis with the young people. But with all of the specialist roles, one of the core components was also that they continue to be supervised and spend some of their time back with their own agency. So those police liaison roles would be very much about interacting with young people on the day-to-day, but also then sharing that learning back with the wider police force as well, and some of their colleagues, about starting to understand and know more about, I suppose, understanding young people from that sort of position as young person first. So very much about that sort of interaction with the young people and then sharing information and learning back to the police force as well. And again, that was the same with the clinical psychologist roles and the speech and language therapist roles as well.
Great. So Ian Matheson's asked, how much of the success would you attribute to the particular local authority and their commitment to making it work?
Yeah, I think it's difficult until we have I think the findings from the randomized controlled trial, where we can see that assessment of the implementation of No Wrong Door in other areas. I suppose this is my own thoughts on this. This isn't a kind of evidence base. This is my own reflections. And I think there has been such a passion and commitment from the North Yorkshire No Wrong Door team that is quite hard to replicate. There is something about that sense of ownership and all of the preparatory work that happened before it started. So I think, there really is something about what is it about that team, the makeup of the team, the commitment, their sense of ownership, and how that can be replicated. Again, I'm just thinking about some of the other conversations that we've had when we've talked about No Wrong Door, and also my experiences over here over the last couple of weeks, is really thinking about the system readiness. So something like No Wrong Door only works well if you can kind of make sure all of those foundations are in place. And if you think about one of the key aspects of No Wrong Door being that continuity of the relationship with a key worker, if you are a provider or if you are an area where you have really high rates of staff turnover, then No Wrong Door is not going to be right for you at this point in time, because actually there needs to be those kind of foundations in place before you can be ready to implement something like No Wrong Door. And I don't think that's unique to No Wrong Door. That is about our learning and understanding of implementation of any programs in child welfare and more broadly.
Hmm. And Heidi's asked, are there any children and young people under statutory orders, or is this strictly a voluntary service?
So it would be a mix. So for the young people who were supported within their birth families, and it was very much the kind of earlier intervention, that would have been voluntary. But for some of those young people who were already in foster care or kinship care, there would have been statutory legal orders for those.
And Lauren has asked, noting that it seems a lot of children were on the edge of care, not in care, do you consider that the model would be as effective for children in statutory out-of-home care where they may not be as able to return home?
So yeah, I mean, although the numbers were much smaller, for some of those young people, it wasn't about, so where they were already in statutory out of home care, it was more about stabilizing foster care placements or kinship placements rather than them being reunified back to birth family. So again, it was for those, sorry, excuse me, that smaller percentage who were in statutory out of home care. It was about using residential care as a support for the foster care placements.
Yeah, great. And Edith has said, thanks for a great presentation. Would you be able to talk a bit more about the data tracker and the process of collecting the data and who does the assessments, etc.?
That's like my favorite topic. Thank you, Edith. So yeah, so the data tracker, so it's captured, as I say, sort of, so basically the data analyst captures the data about the demographics and the reasons for the referral and the circumstances at the point of referral. And then each of the workers that are working with the young people will capture data on a monthly basis around the outcomes. So there will be outcomes in terms of, drug and alcohol misuse, self-harming, criminal offending, engagement in education. And so the workers within the hubs are capturing that on a monthly basis. And then again, for like the assessments, the clinical psychologists will be doing the mental health assessments. All of that data is collated and analysed and then fed back through dashboards and different types of reports by that data analyst. So having the data analyst in post is absolutely pivotal. And I think, again, within the space of this webinar, I might have kind of made it sound like it was really straightforward, but actually it was a real journey that we had to go on with the frontline practitioners to get them to sort of really understand the value of collecting that data, but then also just thinking about the ways in which it was analysed and provided back to them so that they could see the value of them collecting that data. And I think I did touch on the fact that, I think when we started, myself and the data analyst and the head of service were wildly overly ambitious and had to scale it right back.
Okay, well, thanks, Lisa. And then our last question today is from Vicky, and she asks, were they using $20 when the child was placed there on a voluntary basis?
Is that $20 or is that a reference to section 20?
Oh,
Yeah, I
it
thought
looks
maybe.
like a dollar sign on my end. Sorry, I really got to change my glasses. Yep,
No, that's
20.
fine. So yeah, section 20. So section 20 is part of our sort of key legislation. So our Children Act 1989. So where a young person, where they're placed on a voluntary basis, would have been section 20 if they were coming into care, if they were supported with their birth family and they were remaining with their birth family, then they would have been section 17.
Great. Well, thanks so much. I just want to extend our sincere thanks to you, Lisa. Coming all the way from the University of Sussex in the UK. I know you've had a number of engagements here in Australia, and we're very lucky to have had you sharing your insightful and thought-provoking presentations across Australia, but particularly today on behalf of the National Therapeutic Residential Care Alliance. And we're very grateful for your time and your thought leading work and continues to shape residential care and child protection systems. So on behalf of the Alliance, thank you again for joining us. I just also want to take a moment to talk a little bit about the National Alliance, and particularly for those of us joining today, the Alliance now has various membership categories that are open to everyone, as both as individuals and organisations. And presentations like today are examples of the sort of benefits of becoming a member of the Alliance. We're very hard working on advocacy around what is quality residential care in Australia, and we get the very big privilege of linking with people like Lisa in the international working group that you mentioned in your presentation today. And the Alliance is represented on that group through Dr. Trish McNamara from University of Melbourne and other researchers, and including, well, not that I'm a researcher, but I have had the privilege of working with the group now for a few years and collaborating on, some of the material that's been published through that group. So we're very excited about that. And so I just really want to wrap up by saying we will be sharing the presentation today and the recording from the presentation, the slides, but also some membership information, which will be coming out to you. So in future, we'll be running other webinars that will be more closely linked to member benefits, and they'll still be available to non-members, but probably at a fee. So, really encourage you to think about joining the Alliance and coming on board and sharing with us more, really high quality presentations and other range of services that we're going to be offering to members. So thanks again for coming online today, and really appreciate everyone's contribution to pulling this together. And we look forward to engaging more with you in the future. Thanks, everyone.